I'm Dr. Gladys Taylor McGarry, and I've been in the practice of medicine since 1946. I was born and raised in India. My parents were medical missionaries, so when I was 2 years old, I knew I had to be a doctor. I mean, there was never any question. It was just how I was going to do it. My training in medical school was during World War II. Everything that it was the wartime, we were aware of war, and we were surrounded by war. When I got out of medical school and was actively involved in the practice of medicine, I realized someplace along the line that the war hadn't ended. We were still right in the middle of a war against diseases. It was totally everything that we were working with was a war against disease. We were killing bacteria, eradicating AIDS, eliminating diabetes. Our language was against life itself, antibiotics, anticonvulsants. And the one that really got me was the anti-aging thing. What are we supposed to do, you know? The support groups that we had were cancer support groups, epilepsy support groups. They weren't people support groups. And the ammunition that we were evolving and given to work with were medications. You don't stop killing by killing. You don't stop abuse by abusing. You don't teach a kid not to hit by hitting. And yet the very essence of the medicine that we have been practicing was that kind of a war against disease. And in the process of thinking about this and working with this, I realized that we had to shift from the killing modality to what I'm calling living medicine. It was a process of walking away from the war against disease and stepping into a life of healing and living. And it's that kind of a shift. So I had been working with this concept for a long time, like many years. And then when President Obama, at the beginning of this year, asked physicians to help him with this healthcare reform, which was being presented to the world, I knew it was time to step up to the plate and begin to do something very definitively focused towards reform. We would like to have it a groundswell of individual people. The more people that we can get to sign up on our website, the more the government will actually pay attention to this as a possibility, as a viable possibility for healthcare reform.